So good morning friends. So today we'll discuss about the previous year question. So the first question is, the nematoceles in chest X-ray are characteristically seen in pneumonia due to. So the options given are Streptococcus pneumoniae, Staphylococcus aureus, and Streptococcus pyogenes and Haemophilus influenza. So here the answer is Staphylococcus aureus. So you can remember like this whenever they are asking nematocele. Okay, so it is mainly because of the Staphylococcus aureus. So the most common cause for nematocele, it is in Staphylococcus aureus. Okay, so here the answer is Staphylococcus aureus. So here it is nothing but it is in shaggy thin wall cavities in the lungs of the neonates. So and the most common cause is Staphylococcus aureus. So coming for second question. So a gram-negative marine bacterium that causes an ear infection. Yes, it is nothing but Vibrio alginolyticus. So Vibrio alginolyticus usually causes eye, ear and wound infection when they are exposed to seawater because they are the halophilic vibrios. So halophilic vibrios are parahemolyticus, alginolyticus and vulnificus. So the important point you want to remember for parahemolyticus, it is an Kanagawa phenomenon. It is nothing but beta hemolysis in the vacuum agar. So just for completion sake I am saying, and these are the important points. Okay, so coming for this vulnificus, it is an wound maker. Okay, so it is most common in the causes infection in the sepsis patient. So here when compared to parahemolyticus, so the alginolyticus, it is the most common for causing the ear infection. So you can choose that option. So third question is, so the pertussis toxin acts by all of the following mechanism except. So ADP ribosylations of protein associated with receptors. It acts through cyclic AMP and it also acts through G-alpha subunit. But the answer here was increased calcium release from the sarcoplasmic reticulum. So the pertussis acts in. So it is nothing to do with the calcium release from the sarcoplasmic reticulum. Okay. So this mechanism of action is similar to that of the cholera. So toxin, that is, it is also the pertussis toxin will be having an A and B binding unit and it will be binding to the, what is that, GTP, okay, GTP, and thereby activate cyclic AMP. So at the same point. Okay, so this is similar for the cholera toxin. So some of the point you want to remember here is, so it mainly promotes the lymphocytosis. It also causes sensitization to the histamine and thereby causing an allergic symptoms, and it also enhances the insulin secretion, but it is nothing to do with the calcium. Okay, so whenever they are asking for pertussis toxin, you want to remember it is similar to the cholera toxin. That is, it will be binding to the GTP and that thereby causes a release of the increase of cyclic AMP. So next question. So which of the following is correct about the prions? So it has a long incubation period and destroyed by autoclaving at 121 degrees Celsius, nucleic acid present and immunogenic. So here first point, it's a long incubation period. Yeah, it's a true. Okay, so okay, we'll rule the rest of the options. So it is destroyed by autoclaving at 121 degrees Celsius. No, it is 134 degrees Celsius for about 1 to 1.5 hours. Okay, so nucleic acid present? Obviously no, there is no nucleic acid. Because of that, it is not an antigenic and it will be lacking an immune response. So here the answer will be, so it is a long incubation period. Okay, so here the autoclave temperature is about 134 for 1 to 1.5 hours. Okay, so slow viral disease are characterized by very long incubation period and slow course, and ultimately it is fatal. Okay, So next question. Okay, and this is an important question, and this has been asked repeatedly. And okay, herbaceous aspirate from a case of metastatic endophthalmitis. So on culture, it yields a gram-positive round to oval cells, which is about 12 to 14 micrometer. And the aspirate shows the presence of pseudohyphae. Which of the following is a likely etiological agent? Okay. So the options here are Aspergillus, Rhizopus, Candida, and the Fusarium. Okay. So okay, let us see. So first here it is in gram-positive round to oval cells, and there is a presence of pseudohyphae. If there is a presence of pseudohyphae, and this is the easiest clue, it is a gram positive oval this cells. Okay, so if this 2 point, you can clearly make out it is in Candida. Okay, because Aspergillus, Fusarium, and Rhizopus, it doesn't have any pseudohyphae. They are the filamentous fungus. So first point here, it is in presence of pseudohyphae, and second, it is in gram-positive oval cells. So it is nothing but it is in Candida species. Yeah. Okay. How? There is some of the key points for that. I know. I think for Aspergillus, there will be clue like it is an septate hyphae and it has a dichomatous branching at 45°. I'm sure this point will be there. Either it is a septate hyphae or dichomatous branching. For Rhizopus, they will be given sure there will be history of any DKA patients. Okay, so diabetic ketoacidosis, and in the microscopy, and they will be given like aseptate hyphae, whereas in Aspergillus it is in septate. And for Fusarium, they will be giving like sickle-shaped macroconidia. Okay, so with these points, you can easily rule out the other fungus. So here, because of the pseudohyphae, the clear option here is in Candida. Okay, so this history, it is mainly suggestive of fungal endophthalmitis, and the presence of yeast cell with pseudohyphae suggests of Candida species. So the other, that is an Aspergillus, Rhizopus, and Fusarium or the filamentous fungus or the mold. Okay, I told you key points for Aspergillus, it is an dichomatous branching, septate hyphae. For Rhizopus, it is an aseptate hyphae. Okay, and for Fusarium, it is an sickle-shaped macroconidia, and there will be history of some of the eye infections also for Fusarium. So thank you, friends.